USB
有，我这里有。
郭玉轩主持。
是。
Hi, Chris.
Hello, Peter. I see that you've taken a
Good to
nice
see you.
walk.
Good to see you.
Likewise.
What time is it in Singapore?
The same is about
7:30.
7:30.
So now you are in your office or at home?
No, I'm at home. I took the day off.
Ah, well, that's wonderful. I hope I could take a day off. Yeah, I think we should start.
You're just too busy, Peter.
Yeah, well, cut down my practice, and well, I'm prepared for stepping down and preparing for relax.
That's very nice. It's very nice to hear that.
I look forward to your talk, the urgent need for self-care amongst surgeons.
Thank you.
I think that's salary for me. Pleasure for me.
It's for everyone, actually, Peter. It's very interesting. It's a lot of people who are, going through this in many different aspects.
All right. So, Guo Yishen.
I'm here.
Okay, let's start.
Okay. Hi, good morning, everyone. We're honored to have Professor Christopher Goh for today's Dr. Sheng-Po Ho's retirement webinar. Professor Christopher Goh, he finished his bachelor degree in National University of Singapore. He had his fellowship in Royal College of Surgeons in Edinburgh and in Glasgow, UK. He's now a head and neck surgeon in Mount Elizabeth Novena Hospital. He's also a adjunct professor in Duke and US Medical School and past president of Singapore Society of Otolaryngology Head and Neck Surgery. Now let's welcome Dr. Professor Goh for now let's welcome Dr. Christopher Goh for today's speech.
Okay. Thank you for the kind introduction. Just want to share my screen at this point. Right. So here we are today. Good morning, everyone. As you can see from the very first slide I put, it's just to pay a tribute to my very good friend, Professor Peter Hao. He has I've known him for many years now, and he's been invited to Singapore many, many times as visiting professor, as a course faculty in my head and neck course, and also various oncology meetings. Okay, the one thing I know about him is that he likes chili crab. And the chili crab in Jumbo restaurant in particular. So whenever he's in Singapore, I make sure that I will book a place for all of us to have dinner there. Thank you. But also, if you can see on the slide, Peter and I had a chance to have a shot at Singapore Sling at the Raffles Hotel. So another famous thing if you're in Singapore, please go for the chili crab in Jumbo and the Singapore Sling at the Raffles Hotel. Now, this is actually a tribute to my good friend Peter. He's so outstanding. He has this outstanding contribution to head and neck surgery, not only in Asia, but also around the world. It was through his vision and through his hard work that the Asian Society of Head and Neck Oncology was formed, and I believe it remains relevant for all of us here today. So I dedicate this lecture to you, Peter, and I wish you a fulfilling and fruitful retirement. I'm sure that word never applies to you because you're going to keep working and working. But anyway, all the best to you. Now, the topic I have today is the urgent need for self-care among surgeons. I've been in medical practice for almost 40 years now. And over the years, I've noticed that a number of my residents, of junior doctors, colleagues, and even senior surgeons have experienced burnout at some point in their professional life. And that's important. We don't realize that, okay? But a lot of us have, and I'll show you some data. So what I decided to do at that point was to just investigate and find out a little more about this, and even sign up for a mindfulness stress reduction course for myself, so that I'll be, better equipped to give a talk like this. There's certainly ample data to show that burnout is prevalent. So you can see in this publication, 2022, titled Burnout Among Surgeons and Surgical Trainees, is a systematic review and meta-analysis of about 27 articles. 8,600 surgeons were involved from the various surgical specialties. If you look at it, the overall prevalence was 47%. So at any one time, about almost half the surgeons are actually feeling a little bit of burnout, maybe not extreme, but just feeling a little bit distressed. Okay, so it's happening to people around us, but we may not notice it. And if you do feel it, just be aware that others are also going through it. So don't worry too much about it. Just acknowledge it, and we will be ready to engage it. Now, interestingly, the rates per specialty range between 15% to 77%. And guess what? ENT surgeons had the highest rate. A close second were general surgeons. But interestingly, the lowest one was pediatric surgeons. I'm not so sure why. I thought they would suffer a lot, but to suffer with the parents and the children as well. But not true. It's ENT surgeons. So those of you who are ENT surgeons, just be aware that 77% go through some kind of burnout. So first of all, we got to recognize burnout, because some of us are burning out sometimes without realizing it. So, but to recognize burnout, we must look at the parameters. What are the parameters to sort of indicate to you that you could be burning out? One is emotional exhaustion. When you feel that you're very stretched, you're overextended, not only physically, but emotionally. When you go back, you feel very drained, you've been working the whole day, you just cannot catch up. No time to catch a breath. Yeah. And then secondly, there's depersonalization. In other words, when you feel an indifference towards your work, you say, my work, just a chore. I just need to get through it the whole day, and that's it. Or go through this patient. This patient is just a chore. It's irritating me sometimes. I just have to get through it. And then if that's the kind of attitude that you have towards your work, then maybe you are having burnout. So just be aware. Yeah. Finally, a poor sense of personal accomplishment. A lot of you out there have accomplished a lot, I can tell you that. But sometimes at the end of the day, you say, hey, did I really do a good job? Is it really valuable to me? If you feel that way, then again, look up for burnout. I'm not saying that you should be so proud and say, oh, I'm the best surgeon, I've done this, I've done that. I'm not saying that. But if you have achieved something, you should be able to acknowledge it and say, yeah, I have done this much and I enjoy it, and I want to do maybe some more for the community. So look at the common causes of burnout. So external sources or external cause: heavy workload, okay, long working hours, sleep deprivation, typical of a lot of surgical disciplines. Then don't forget the challenges with patient care, right? Not all patients are easy, not only in terms of personality, but also disease, right? Some disease is very complex. You're trying your best, you try to cure, you do this, you do that, sometimes not successful. So that's very challenging. Then a lot of surgeons forget about their work-life balance, right? We're all enthusiastic. Most of us wake up very early. You're at work very early. We are back, we get back home very late. There's no work-life balance. And over the weekends, we're also seeing patients, doing our ward rounds. All right, so don't forget that work-life balance is important as well. Also, relationship with colleagues, right? If you don't get along with your colleagues in your unit or in the hospital, then there could be something quite toxic for you. All right, so be aware of that, and sometimes you have to either address it or do whatever you can to have a good relationship, or maybe even have to move departments. Okay. And then finally, there's mistreatment by seniors. Okay, a lot of junior doctors tell me that, my so-and-so, this consultant is not very nice to me, and not only that, maybe wake up early in the morning, do this, do that. And then they take all the credit for themselves, giving me nothing. So that's quite common. The institution is the other one. A lot of times, institution may not recognize your work, do not want to give you promotion, do not want to pay you sufficiently. This institution, or worse still, national policies, right? You can get national policies that you disagree with, and then you have a major problem as well. Some of them are internal. It's the characteristic of the individual. So this one, maybe we can work on it and try to help improve. Okay. For example, a lot of us have negative self-talk. It's quite common to have that. I'm going to share with you about negativity bias later. Unrealistic expectations. Right? When you do surgery, you expect 100% no complications. You know, you and I know there's no such thing. If you have a paper that's published, for 1,000 surgeries, no complication, you know something is wrong somewhere. There will be. You have to be realistic. You're a surgeon. You are dealing with different people with different parameters, different kind of diseases. Surely, sometimes you don't succeed. And some people have this tendency to ruminate. If something disturbs them, they're disturbed by it for a long time. The whole of that day, the following day, maybe one whole week, they're still thinking, oh, this person said this to me, or this thing happened, and so on. This is called rumination. You keep thinking and thinking. And this is because of lack of discipline in your mind, which I always use the word discipline, a lack of training in the mind. We're going to share with you later. Everybody has an aversion to uncertainty and lack of control. Most of us want our lives to be under our control. But when you do surgery, not everything is under your control. Things seem to be going well, and suddenly something happens. Or everything seems to have gone very well, but at the end of the surgery, the outcome is not good. So you cannot have control. By and large, you do your very best, and most of the time, I would say 90% of patients do very well. But there will be some that you don't. And this very some, a little bit of them, that disturbs you and make you think about them again and again and again. Okay, so this is the lack of control. Of course, those with mental health, anxiety issues need to also address them and be open to having that being addressed for you. So what are the signs and symptoms of anxiety and depression? To look out in ourselves and also for our colleagues. So look out for your friends as well. Don't only look out for yourself, right? So when someone says, or when you have got tightness in the chest, abdominal discomfort, palpitations, changing in eating habits, doesn't mean you lose appetite. Some people eat more. So it can go either way, but basically there's a change in your eating habit. You could be eating less because you just don't feel well, or you take it as a means of distraction and you just eat more. If you have been sleeping poorly, you've got poor quality sleep, you've been waking up a lot at night, and in the daytime you feel very sleepy, it may not be sleep apnea. It could well be because you're having a bit of depression or some burnout issues. And same for constant fatigue. What to look out for emotionally? If you're very moody, irritable, aggressive, I know surgeons are aggressive, but if you are, when you're overly aggressive, something could be wrong, because you could be using it as a means of hiding that you're having depression or stress. Certainly, difficulty in concentration is one. If you cannot concentrate, your mind is just moving from place to place, you could well be burning out or having distress or stress. When you're withdrawn and you feel hopeless, you say, I can't do anything much, I give up. I just give up. Yeah, so these are things that you look out for yourself and for people around you. Okay, so it's also good that you pick up these things for your colleagues and friends and juniors, for those of you who are in your senior position. So after recognizing it and identifying burnout, how do you address it? You address it in 3 different ways. One is you address it on the individual level. All right, on the individual level, I'll go through with you about emotional intelligence, mindfulness, and resilience. So my talk will focus more on the individual. I'm not going to say much about the institution. You all have your different institutions with different policies. But some institutions have now started initiatives for mentoring and support. An institution that is ready for this are those that have got support system. So if your institution does not have something like that, go around, knock the door of your HR or somebody up there and say, look, hey, how come we don't have this thing? Why not introduce this to help the doctors and other healthcare professionals as well, not necessarily doctors only. And then national policies, a lot of us do not have any means of affecting national policies. So I'm going to leave that alone. But if you do have, then look at giving opportunities to your doctors, leadership, and so on. So let's look at the individual now. Right. So for the individual, first of all, build personal healthy habits. Exercise. Okay, regular exercise obviously helps. Everybody knows that. The question is, do you give yourself time to exercise? Sometimes it doesn't need to be a time carved out. Maybe when you are going to work, maybe you park a little further and you walk, for example. But if you have the time, please, in fact, it is good to set time for exercise. Healthy diet, I think you'll know more about it. Not too much fatty diet, more fish, vegetables, that kind of thing. Certainly to reduce time spent on your TV, your phones, and your social media. We often forget that we are spending a lot of time on the phone, replying to something or watching YouTube and so on. It's useful time, of course. Sometimes you need to use your phone, sometimes you need to look at YouTube to learn something or other. Sometimes to relax as well, but you've got to be mindful of the time that you spend. Don't forget to give yourself some time for hobbies. I know I talk to some people and say, what are your hobbies? And they say, what do you mean by hobbies? I don't have any hobbies. I don't need any hobbies. I just spend time working. But when you hear that, means it's not a very good sign. Do have time for hobbies. It could be a simple thing as just taking a walk in the evening or playing badminton with a friend. It doesn't matter. And connecting with nature is also important, actually. If you have the time, and in some of your countries you have a lot of nature. Even in Singapore, where we are, a very built-up area, there are areas where we can take a walk, like gardens by the bay and so on. In our botanical garden.
Yeah.
Yes. So thank you, Peter. Botanic gardens. So these are areas that I think Peter himself has spent time walking and enjoying nature. So connecting with nature is important, and certainly in Taiwan there are a lot of nice places I know, because I've seen that in Peter's Facebook post. So we start with self-compassion. We need to define what is self-compassion. Self-compassion is being kind and understanding towards ourselves when we fail, when we suffer, when we feel inadequate. Is to be kind and understanding and recognize it rather than ignore our pain. Or worst of all, when you beat yourself and say, well, I'm terrible today, I'm this, I'm that, and you criticize ourselves. So the important thing is actually to recognize that you are actually lacking in self-compassion. That you're even ignoring the fact that you are suffering from it. Okay, so the point is that you need to recognize it, first of all. And after recognizing it, you just be kind to it and say, look, yeah, today I just don't feel so good. Or today, yeah, something didn't go right. And then and don't beat yourself and say, look, I feel it, I recognize it. I just be kind to it and say, look, yeah, not to worry. So because if you practice self-compassion, you will increase your emotional resilience and your well-being. Okay, and this came from a study from Professor Kristen Neff from Texas, and he divided into 3 components for self-compassion. So you can see the 3 components here. Self-kindness, the word mindfulness is coming in now, and I'm going to expand on it later, and common humanity. So self-kindness, I mentioned a little bit just now, being loving towards ourselves, and also don't forget being loving towards others. When you're loving towards others, you also find it easier to be loving towards yourself. All right. If you are harsh with others, then when you make the same mistake, you also tend to be harsh with yourself. Okay, so when you are loving others, you can also be loving to yourself, and you'll also be less critical. Yeah. Mindfulness is about being aware and bringing you back to being aware and not giving any judgment to what you're aware of. If you're feeling down, don't judge yourself and say, oh, I'm terrible. Other people have got so much energy, they can do this and that. Just be aware and don't judge it. And I'm going to go through a bit more on mindfulness later. Now, important thing is common humanity. Whenever something has gone wrong, or you're feeling down, you're feeling depressed, so on, just remember that actually the truth is everyone suffers. As you can see, I show you the data, almost half of the surgical population do suffer some kind of distress, burnout, depression even. Yeah. So remember that you're not alone. Okay. Also remember that you're not perfect, because no one is. Don't expect to get 100% success in all your surgeries, for example, without a single 1% of complication. Okay, because everyone is the same. Everyone is equal here. Right? No one is greater than the other, because we all suffer in our own ways. You might look at somebody and say, "Oh, this person is so successful. I wish I was like him. I want to be like him." But not true. Okay, everyone suffers in his own way. So, what are obstacles to self-compassion? Harsh judgments of ourselves. You can be critical of yourself in a very discerning and wise way. You need to learn from mistakes as well. There's no question about it. But it is the way you engage it that's important. If you just keep being harsh and I was just stupid this one, I did that. It's not the way to go. I think if you make a mistake, say, look, let me just take a rest, relax first, let me go over this, and then let's learn from it, with wisdom. So the harsh judgment, some people think, oh, this is the way I can improve, right? Because they believe that criticism drives motivation. If I criticize myself, I'll do better next time. Not true. Okay, if you have a discerning wisdom, you will still motivate yourself without being too harsh. At the same time, self-compassion is not self-pity. You can say, oh, you poor thing, you're this, you're that, give all kinds of excuses and so on. Okay, self-pity and self-indulgence is not about self-compassion. Self-compassion is looking at it squarely, and tell yourself, look, this is what has happened. I know, I acknowledge it, tell myself it's okay. Maybe others have done the same thing as well. And then if you want to motivate yourself to improve, then say, let me catch my breath and improve again. Now this word mindfulness, I want to introduce to you. Some of you are familiar with it, I'm sure. So if it is, then just bear with me. But basically, mindfulness is maintaining a present moment awareness of our thoughts, our feelings, our sensations, and the surrounding environment. You're just aware of everything around you without giving a judgment. Okay. The key things are this: you must be aware of what you're doing and pay attention to what you're doing right now at the present moment. Very good example is, for example, in the morning when you first wake up and you brush your teeth. Very few people will be paying attention, say, oh, I'm lifting up my toothbrush, I'm applying the toothpaste, I'm brushing my teeth now, paying attention to the brushing of the teeth. Most of us will just be automatically doing the same thing without even realizing that you did it. Even not even paying attention to the fact you put toothpaste on the toothbrush, and then while you are brushing your teeth, guess what you're doing? You're thinking. You're thinking and thinking of something else not related to brushing your teeth. So it's about paying attention to what you're doing at the present moment, of course, without judging it. Okay, you can't say, oh, my toothbrush is no good and I'm not brushing well and all that. So not judgment. And then don't forget the kindness part. Bring kindness to everyone and everything that you do as far as you can. Okay. And the reason why we teach or we learn mindfulness is to train the mind, to rewire the brain so that the brain becomes more and more in tune to bring yourself back to the present moment rather than to be thinking of other things. Because if you allow that to happen, you will also begin to think of all the bad things that happen throughout the day, and then you keep playing it again and again. Okay, and this happens because it's automatic. You haven't trained it or rewired the brain. Okay, but there are different types of mindfulness practice, and I'm just going to go through. We're just going to touch the surface. I know it takes a long time. It takes about 8 weeks to go through mindfulness practice for stress reduction. Most common is mindful breathing. That's the formal practice. These are formal practices where some people talk about meditation as well. It's almost like meditation, but whenever you are under a lot of stress, one thing to do is just bring yourself back to your breathing and say, look, I'm breathing. Okay, and so easy to do. Even right now, as I'm speaking to you, you can say, I'm breathing in and take a nice deep breath, hold it for a little while, and then to release and breathe out. Okay, ideally, the breathing in should be about 4 to 7 seconds, and the breathing out is a bit longer, something like that. It doesn't matter. Don't spend too much time also thinking about how well you can breathe. Okay, so the point is you're trying to bring yourself back to a point where you can pay attention to something that you're doing right now, which is breathing. But if you don't like to watch your breathing, you can be mindful of sensations. You can say, well, I'm in an aircon room now, it is cold, or in your country now it's very warm or very cold. I can also, sensation also means hearing. I'm hearing the birds. Right now, I'm sitting here, I hear the birds. Okay, and it's a present moment, and I don't judge the birds. I don't say, oh, you don't even say it's a beautiful sound, just say, it's a bird, I'm enjoying it. That's it. Okay. And for some, of course, reciting a phrase or a word like om, or something. I just give you an example. It could be anything. All right, is to bring you back, to bring your mind back to the present moment. Because sometimes when you're, let's say you're brushing your teeth and your mind goes to something else, you bring yourself back to the sensation of your toothbrush touching your teeth, for example, is a good example of informal practice. Okay, so these are informal practice. So activities of daily life, like when you're eating or having a meal, washing your hands, commuting to work, if you're driving, of course, you must pay attention to the road, don't get involved in an accident. But you just tell yourself, look, I am here mindfully driving, I'm enjoying the road and the view and so on. Or even something like a chore, like tidying a room, if you do it mindfully, I think you will enjoy it a little bit more. Okay, so eating a meal, for example, or drinking coffee is a good example. Most of the time, we just take the coffee, we put it in our mouth, and we drink, and then we forget all about it. But if you want to do it mindfully, you look at the cup, you say, now I'm going to drink my coffee. I give it a sniff. I like the smell of the coffee. I put it in my mouth. I take a sip. I enjoy the taste, and then I put the cup down. So this whole process becomes mindful rather than while you're drinking coffee, you're thinking of today I've got this work. I'm going to meet this terrible colleague of mine. My boss is horrible, and so on. So it's when you do that, you don't enjoy the coffee in the first place. Yeah. So mindfulness is to bring you back. Whenever you have a thought, just bring yourself back. Don't scold yourself and say, I cannot have that thought. You can, but bring it back to your breathing, to what you're doing right now. Unless the thought is something that is relevant for the present moment. So why has it become mainstream? Mindfulness has been investigated for over 20 years already. Okay, and there's a lot of evidence, now more and more, a lot of publications, and it benefits physical as well as mental well-being. Okay, and certainly has been adopted in healthcare, education, even in sports. The performance of sportsmen improve with mindfulness practice. And in fact, in anything that you do, not only that, your surgical skills, your what have you, they improve with mindfulness. Another publication, this one is in 2021. They are studying the effectiveness of mindfulness-based stress reduction on the psychological functioning of healthcare professionals. As a systematic review, 30 studies, okay, shows that for most of the participants, a decrease in anxiety, depression, and stress, increase in mindfulness and self-compassion, and therefore you decrease burnout and you improve resilience. So that's important. Now, I'm going to finally talk about negativity bias. So remember that if you leave your mind to go and do it, whatever it wants to do, and think whatever it wants to think, most of the time, automatically, it will have a negative bias. The automatic negative thoughts come in more frequently than a pleasant thought. Okay? All right. So it's our tendency not only to register as negative stimuli, but also to dwell on these events. So if something is negative, you tend to think, if you see a cockroach and you don't like it, then you think of the cockroach the whole evening, the kind of thing. Okay? Whereas if you watch a movie that's nice, maybe you remember it for a while, and then so in almost any interaction, we are more likely to notice the negative things and to remember them vividly. If somebody just shouts a lot in the office, then you begin to think of the whole day, this person has been in a bad mood and so on. So the bias towards negativity leads you to pay more attention to the bad things that happen. And they seem to be more important than they really are. They're not really as important as you may think. So we remember traumatic experiences better than positive ones. When someone insults you, you remember more than someone who praised you. Right? So just remember that. When someone insults you, you just remember it the whole day. They praise you, yeah, I remember that for maybe 1 hour. I say, well, I feel good. And you think more negative things more frequently. Okay? And respond more strongly to negative events to equally positive ones. So let me see now. So what is like this is that when you if you tell someone, if you don't finish this work by this date, I will sack you. That seems to work better than you say, if you don't finish this work by this date, sorry, if you finish this work by this date, I will praise you. Okay, you will find that you respond more the first. If your boss tells you, you don't finish this by this date, I will sack you. You will definitely want to finish it by that date. But the boss says, well, if you finish this by this date, I will praise you. I will give you a praise. Maybe you're not so well, you like it, but not as strongly as if the boss threatens you. Okay, so this negativity bias has been ingrained in us, so we got to untrain it so that we don't just respond to threats all the time. All right, it's not the way to live life also. Huh? But where does this negative bias come from? You see, it probably is a result of evolution. Earlier in the human history, paying attention to the bad and dangerous things were a matter of life and death, right? So if you see a tiger in the wild, when in the caveman period, of course they should be paying attention to it and avoid it, because it could be life and death. If you're not paying attention to the tiger footprints on the ground, you still walk in the same direction, then you will be killed. But in our history today, whatever it is, even if your boss threatens you, you will never be killed. Okay, and you know that. All right, but we are so in tune with it that we get very fearful. We believe as if it's so real that I'm going to die because of this. Something I'm going to die. Something has happened. But that's only in history, where a lot of things are really life and death. For most of us, a lot of things here are not really life and death. Okay, they're not such a big deal. Not at least not life and death. Yeah. So that's why we dwell in this negative things instead, because the brain has been wired to do that. The brain has been told, hey, keep this guy safe. So show him all the things that are dangerous, so that he can be kept safe. And towards now, everything becomes dangerous. Huh? You go to a place, they say this is dangerous. You do this is dangerous. You do that is dangerous. Now, the good news is that there's neuroplasticity. And the reason why we try to get into mindfulness is because the brain can actually reorganize in its structure and function. All right. It's called neuroplasticity. Okay. How does it occur? They did studies, as I mentioned, right? People who do mindfulness practice, and some of them do meditation, and then they do a functional MRI. And they found that both the structure and the function of the brain, and don't forget this functional MRI, the vascularity and so on changes. For example, the prefrontal cortex, for those who meditate after several hours or several weeks or months, it gets thicker. Okay, and maybe the amygdala, which is the one that that makes you worry about everything, gets a bit smaller. Okay, because there's new synapses, and you strengthen the new synapses, or you strengthen the bad ones if you are practicing bad things. But if you're practicing mindfulness, then you are strengthening the good synapses and you're weakening the bad ones. Okay, to be fair, it's not bad or good. We should start being judgmental. Strengthening the synapses that make you feel comfortable and confident, and then weakening those that make you feel anxious. All right, so no judgment here. It's about strengthening synapses. And the reason why it can happen even at anybody's age, those of us even in retirement age like myself, it can still work. All right, there doesn't seem to be an age limit here. So I'm going to leave you all with some mini assignment. I would just encourage you to schedule a time in your day, every day, if you can, to sit a little while in silence and do a short mindful practice. Maybe just some time in the office when you want to have a cup of tea or coffee. Just give yourself, 5 minutes to just take a break. Pick the cup of coffee, give it a sniff, enjoy it. Don't be caught up with the things around you in the office. Just focus on the coffee that you've prepared or somebody has prepared for you. Give it a sniff, and then take a gulp or a sip, and then enjoy. Just sip it slowly, enjoy it, and then just take that time out where your mind is just focused on what you're doing right now, and don't worry about all the deadlines that you have to catch. There are also apps that you can put that you can subscribe to. In fact, it's free, I think. Okay, so you can download this Headspace or Insight Timer. It's free. and you can download it in your handphone, and you can bring it along with you, and they've got different ways of helping you get into a mindful practice. I also encourage you to keep a well-being journal. Okay, sometimes it's nice to just keep journal so that you incline yourself towards gratitude. Like today is a good day. I went for a good walk. I managed to listen to the birds. The hill that I walked out was beautiful. The flowers are blooming, things like that. So this, and I'm very thankful for it. Okay, so be thankful for all the good things, so that you will incline your mind towards good things only, and positive. Well, it's not so much training you to have positive thinking. This is not about positive thinking. Mindfulness is about actually being aware of what it really is. But if something good happens, it's nice to just jot it down. So I'm going to conclude here. So you will know by now that burnout among surgeons is more common than you think. And around you, there could be, a few who are suffering silently or don't even realize that they are. So it's important to recognize that you may be suffering from burnout, or others as well, so that you can help them. And developing healthy personal habits and self-care can help prevent burnout. Mindfulness and self-compassion, which I just touched a little bit today, these practices are useful. They are there to help mitigate the effects of stressors and daily living. And finally, of course, if you do have a true mental health problem, do seek professional help. Thank you all, and I'd like to thank Peter for the invitation to be here to share this with all of you.
Thank you, Professor Go. I really appreciate you that you focus on this topic, because I totally agree that this is really an urgent need. I think it's really difficult for those people who are maybe surviving well or performing well to imagine that there are certain of people suffering from their mind. And I think self-awareness is the most difficult part, because we usually think that everyone are doing the same, everyone think the same, and why everyone can conquer and I cannot conquer. But the fact is that everyone is different. And I totally agree that these need practice. And I like the slide that you say that we need formal mindfulness practice, because we don't do this in our real practice. And I think it's really important to tell ourselves that it's okay to be not okay, because we always taught to be strong, to be tough, to conquer everything, but actually it's not really happening that well. Yeah. So thank you very much. And now let's open to the floor for questions.
Thank you so much for that comment.
Is there any question from the floor?
Well, Chris, I have to say, I have to express my gratitude to you, because your talk always inspire me. And I have to, confess that, in the past, you really helped me. And even for this lecture, you really rescue me out. And I thought, and I think Dr. Guo also, because I know Dr. Guo has been, suffering or struggling with, some, events. I know, and but and just listening to your talk, I think that would be very helpful to all of us, everyone, because I think most of the surgeons are, in emotional distress, or in, and, burnout anyway. And for my own experience, I think, Chris, I think you remember I have been talking to you about what to do next, and what to expect when I move from the Chang'an Memorial Hospital to my current hospital, Sheng-Po Hospital. And at that time, I don't really know what to do, because at that time I established the DHNS and Asian Society Head and Oncology, and it seems to me that I reached some plateau, and I don't know what to go for, and what my goal is. And then you actually help me, actually teach me that take the second wind. And I guess you remember that. I will always remember the words, the phrase, take the second wind, so that I I really appreciate what you told me, and I really sit down and think what I'm going to do and what I have and what is my goal and what I'm going to achieve, and then give my thoughts on it, and then I take the second wind, and then I step out of the head and neck society, and then I try to serve not only head and neck but also in the whole otolaryngology field. So I take over the Asia Oceania Association ENT, and then after taking over the Asia Oceania, I start to think maybe I should do something more. So not only for ENT business, but so that's why I also devote myself, take perhaps the third wind. Not it's a second wind. Yeah, perhaps the third wind. Yeah, to devote myself for NGOs, for global otolaryngology initiatives to try to help ENT surgeons or some others in the Africa or in the Asia Oceania, in the small island countries in Asia Oceania around Singapore and around Australia, and then out of the ENT fields to I kind of becoming a 执行董事. I don't know how to say it. It's a good position in the consumers foundation in Taiwan, and I try to develop. So that's really not only in ENT field but also working out of ENT field. So that's just all because of your work, all because of your wise, your wisdom. You teach me and you mentoring me to take the second wind. So I really need to sit down and give yourself some time, and then sip a cup of coffee, and then you might ease your mind, and then you could start from there. Yeah, and I really enjoy, I love to go to Botanic Garden. It's all because of you. And so every time I went to Singapore, I went to a Botanic Garden. And now, because last time you told me the Garden Bay is even better. So, and then I went to Garden by the Bay all the time now. And so not only Botanic Garden, but also Garden by the Bay. So it's all because of your, introduction and referral. So I really enjoy your wisdom, and really help. That's my personal experience, and I think because I'm just a head and neck surgeon, I'm just a ENT doctor, and I think we all face the same problem. So really, thank you for helping me. And I think you got the ability to. You should give this kind of talk more, so that everybody would learn from you. And as long as we are more healthy, and then we could serve more people, right? Yeah.
Exactly. Absolutely. Absolutely.
Yeah. Thank you,
Peter. Thank you for your very kind comments and also for sharing. I'm just happy and proud to be associated with you. Very proud. But don't ever forget that I am full of admiration for you. Okay, so you've done so much that most of us cannot have achieved. So
well, it's all because of you as well. Because I think we work together, and you help me, and I help you, and so we did all the things together. Yeah, Chris.
Thank you.
Very good friends, Chris. Yes.
Yeah, we are. Thank you. Thank you. Indeed.
Is there any other question or comments? Yeah, and certainly I would go through your talk again. Yeah, and but as the time is up, I need to introduce some of the next speaker. That will be 2 weeks later, on July 15, our good friends, Professor Meijin Nakayama from Japan, he's going to talk about the minimally invasive open laryngopharyngeal surgeries, and then our friends Kitty Rat Ukonut from Thailand, and she's a famous pediatric otolaryngologist practice in Bangkok, and so the development of artificial intelligence model to interpret the findings of otoendoscopic examination of otitis media in children, and so I do expect everyone could log in in due time and listen to all this wonderful talk delivered by very distinguished professors, and so and I think that would be good to everyone. So thank you everyone for joining us for Professor Christopher Goh's talk this morning, which I think is just wonderful, and everybody should be aware of that and should look into yourself and give yourself some time, give yourself a space for yourself, and be get along with get well along with you with yourself, and so that's very good to our mental health, and by doing that we might be able to help more people. So Chris, thank you again for your wonderful talk, and also your support, and also your friendship, and I hope you could visit us again with your beautiful wife in Taipei, and then certainly every time I got a chance to go to Singapore, I will visit you, and certainly you would invite me for chili crab.
For sure, it will be my pleasure, Peter. Looking forward to it.
Yeah. So thank you for your wonderful talk. Thank you. And we are going to close the webinar here, and thank you, and bye-bye. Have a good day.
Okay.
Thank you.
Nice to hear you. Bye-bye.
Yeah.
Thank you all.
Bye.
Yeah.
Bye.
Hi, Chris.
Hi.
Just talk a little bit.
Oh, okay. Are you busy? No?
Yeah, and today I will be very busy because last night I got 38 calls from the hospital, and I find out that the calls say it's my patient, but actually not my patient. I have to wake up, start from 2 or 3 o'clock at midnight and until this morning. So and happened to be not my case. Anyway, I think there is some mistakes, and and now we could laugh at it, and but that's life.
That's life.
That's life. Yeah, that's life. You have to manage it, and that's
Challenges of patient care.
yeah.
Challenges of patient care. And being mindful, of course. And I hope you're not so upset when you're being called wrongly.
Yeah. Yeah. And so I wake up and drink a cup of coffee, and I think, oh, I'm going to listen to Chris talk. So I'm so happy, and then because although I watch your theme, your topics, and I realize that you are talking about something which we really need, and I really look forward to it, and you never disappointed me. Thank you so much.
Thank you.
And
So
then even for Dr. Guo, I think so if you look at her, she listened to your talk so seriously.
Yes.
Really, because I think she really needs your talk. Yeah, to help her. Yeah, is that right, Suana?
Yeah, I
You're
totally
so
agree.
serious. Yeah, so serious. I look at your face. You're so serious to listen to.
Well, thank you
Yeah,
for
I think everyone needs this talk, because really seldom that in this kind of webinar or lectures outside anyone will put focus on it, especially in head and neck surgeon. Yeah.
Yeah, yeah.
I'm glad.
I said I love diversity, and we sometimes forget, something, fundamental, which is your mental health. The surgeon's mental health. The surgeon going to be burned out anyway. In some time in your life, you're going to be burned out, and then prepare for it, and then you listen to Chris talk, and then you know what to do. Yeah, and then perhaps you practice today, right?
Yes, please practice. Yeah, you have got some mini schedules. Yeah, so just take your time to do that.
Yeah,
Some assignments for you. You got to be also a little. You got to give some time for yourself.
yeah. I think that's really. So thank you, Chris, and say hello to your wife. All right.
Yeah, and say
Yeah,
hello to
yeah.
Helen, please. Please say
Okay.
hello to Helen.
Yeah. When I had coffee this morning for breakfast, I talked to Helen that you are going to talk. I don't know if she's online to listen to your talk or not, but anyway, we talk about you are going to talk, and we really expect your talk. Yeah. So thank you, and have a good day. All right.
Not at all. You too. Yeah. Everyone. Bye bye.
Yeah.
Bye-bye.
Bye bye.
Bye.
No,